Live Fit Podcast, episode 111, Functional Medicine with Dr. Will Cole.
Welcome to the Live Fit Podcast with Glenn Johnson, your resource for all things that contribute to good health. You will hear expert advice and interviews with leading authorities on fitness, food, fat loss, mindset, and the mind-body connection. You will find show notes, articles, and health programs at livefitpodcast.com.
Yes, it is time once again for the Live Fit Podcast. I'm your host, Glenn Johnson, your guide to better health. Thank you, everybody, for listening. Today, I'm speaking with Dr. Will Cole. He is a functional medical doctor who treats many of the diseases and issues that Western medicine has a hard time dealing with, such as fibromyalgia and adrenal fatigue. And he said that relying on Western medicine's healthcare for your health is like relying on life insurance for your life. Western medicine is designed to treat illnesses, not to correct the problems or prevent the problems from happening in the first place. Let's jump right in and hear what Dr. Cole has to say about functional medicine and how he can help you. Thank you for being on the show, Dr. Cole. One thing I really love about functional medicine is it's more aligned with preventing illness or allowing the body to heal itself rather than just putting a Band-Aid over it and patching it up or forcing it to do something that just doesn't quite work with the entire system as a whole. But before we get into what functional medicine is and, most importantly, your unique niche and how you do it, can you give us a little background about who you are so we know where you're coming from?
Yeah, my name is Dr. Will Cole, for those of you just tuning in. My doctorate is from Southern California University of Health Sciences in Los Angeles, and my postdoctorate education and training is in functional medicine and clinical nutrition through the Institute for Functional Medicine, IFM, and Functional Medicine University. I'm one of mindbodygreen.com's, actually the biggest wellness website in the world. They have like 50 million readers and listeners. And I'm one of their course instructors and wellness experts where I get to teach about functional medicine in different ways via articles and research and via video classes and different mediums there. So, and I have a virtual functional medicine practice. So about 75% of my patients are done via webcam and phone consultation through drwillcole.com, and we have video classes there as well. And then we see patients locally in the Pittsburgh area, land of the champions. And so that's in a nutshell what I do, and I love what I do.
What exactly is functional medicine?
It's a great question. Another word for functional medicine, for those of you who haven't heard about that term before, is integrative medicine or systems medicine. We're looking at the systems of the body that when they're working well, they give rise to optimal health, and when they're not working well, they give rise to chronic health problems, hormonal imbalances, autoimmune conditions. So we're looking at these underlying root issues. And if you had to kind of differentiate between functional medicine and mainstream medicine, it would be boiled down to a few different aspects of it. First is that we interpret labs using a thinner reference range. And all your listeners know if they have a lab from their PCP or endocrinologist or another mainstream specialist, they're going to have their numbers on the lab compared to this reference range. And it says, from X to Y, that's where your number should be. And if it's not inside that range, it's high or low, it's a bold font, and it's talked about at that point. Maybe it's talked about at that point. And we have to ask the question, where do we get that reference range? Well, it's a statistical bell curve average of people who go to that lab. And people that typically go to labs are people with health problems. So there's a lot of us that go to the doctor and say, hey, like, why am I feeling the way that I do? And let's get these labs ran, and the labs largely come back normal, or all of them come back quote unquote normal, even though, instinctively, heck, I'm not feeling normal. Why am I told everything's fine when I know everything's not fine? And you're told you're just depressed, here's an antidepressant, or you're just getting older, or you just need to work out more, you just need to eat less, all those sort of well-intentioned reasons. But if you're going through symptoms despite quote-unquote normal labs, what they're unintentionally saying is you're a lot like the other sick people that make up the population of that lab. Because if that's happening, they're either not running the right labs or they're not interpreting the labs they are running properly, or both. So in functional medicine, we take people with health problems out of that reference range on your labs. And what's left? It's people that live long, healthy, thriving lives. And that's a much thinner range within that larger normal lab reference range. The second thing we do differently is we run more comprehensive labs. So we're looking at things like microbiome, gut dysfunctions, toxicity issues, hormonal imbalances, food sensitivities, inflammatory issues, these root pieces of the puzzle that give rise to why people feel the way that they do and why people are labeled with an ICD-10 code, a diagnosis code. And then we realize everybody's different. So there's not a cookie cutter, one size fits all approach to getting well. And what works for one person with the same diagnosis code can flare the next person up. And the next person, we don't notice a difference, good or bad, and that's not good either. So we try not to have a bias as, this is the route that somebody with chronic fatigue or an autoimmune issue or a gut issue or a brain issue goes through, because we have to look at their labs, we have to look at their health history, we have to look at what works in their life and what doesn't work in their life to really be customized based on the individual. So we use food as medicine and on a really customized way. Because even healthy foods can flare some people up. If you're getting flared up by onions and garlic or salads or gluten-free grains or gluten, we have to find out what works for your body, what doesn't work for your body. And we have to use herbal botanical medicines based on your labs. And we have to do address lifestyle changes as far as stress management, physical activity, mind-body component. So that's in a nutshell my long-winded soapbox as to what we do in functional medicine.
Well, that's fine. And I love your nutshell soapbox or your nutshell on the soapbox. I have a interesting image in my head right now. I have lots of questions. May I?
Yes, go ahead.
Okay. What's your specialty?
So we see patients around the world via webcam consultations, like I said. And we kind of boil it down. And again, these categories are interchangeable, meaning that normally if someone has one of these, they're going to have more than one of these. But just for people's awareness of, they think, well, that's my problem. But more or less the body is interconnected and more than one of these areas are being impacted. So we deal with people with brain issues like anxiety, depression, and brain fog. We deal with people with digestive issues like constipation, diarrhea, IBS, leaky gut syndrome, SIBO, histamine intolerance, these type of issues. People with autoimmune problems. There's over 140 different autoimmune inflammation spectrum issues. And we deal with people with specifically hormonal problems with thyroid issues and people with HPA axis issues, or what's commonly referred to as adrenal fatigue. So those are the people that I have a heart for and the people that we see to varying degrees on an hourly basis here.
It sounds to me that you specialize in the issues that, and I'm going to use air quote, regular doctors have the hardest time working with as far as solving the issue. Is that fair?
Yeah, exactly. Because there's no clear medication for really any of those people that's going to at least solve their issues sustainably. There can be honeymoon periods for all these people with little glimpses of hope with pharmaceuticals or this, next thing to do in mainstream model of care. But yeah, you're right. Sustainably speaking, those are people that are disenfranchised. They're really not, for the most part, finding sustainable solutions within mainstream medicine. And I really feel like that is the success of functional medicine, and what we do best at is really filling in the gap and finding solutions for everyday normal people, working class people that are trying their best at doing these healthy things. I mean, most of our patients are very health savvy. I mean, they listen to all these wonderful podcasts. They are like immersed in Dr. Google because they've had to be their own health advocate and had to be their own doctor in some way because they've been so miserably failed in the mainstream model of care. They're very smart and they're not eating the standard American diet. They're eating healthier than most people, but despite their best efforts, they're still struggling with these health issues. So it's my job to deal with these difficult cases to dig deeper, find out what's not being addressed, and aggressively take it to the next level.
And this is really difficult for somebody like me, a health coach, who just, it's out of my scope. It's beyond my knowledge and ability and experience, because if they are doing everything quote unquote right, what at least appears to be, they're doing everything to promote good health, and yet they're still having issues. I'm kind of left shrugging my shoulders and raising my hands up in the air, saying, I don't know what to do. So I send them to you.
Yeah. I mean, it is like it's a sacred journey. It's one that I know, like, they've been through hell before they've met me for the most part. And this is like many people are burnt out and just like want to see some relief. So we don't take that lightly. And yeah, so it's not for the faint of heart, but we're up for the challenge.
So tell us about adrenal fatigue. Is it more complicated than it sounds? Because to me it sounds like, well, you've just been running on empty for too long and now you just need a good rest, vacation, or 2 weeks laying on a beach or something.
And that certainly would be a nice tool for somebody with a HPA axis issue. So adrenal fatigue is, very loosely, it's a term that we use a lot in functional medicine and in the wellness world, and that's great. It's what it's known as, but it's really not an adrenal-based issue. It's something dysfunctional with the hypothalamic pituitary adrenal axis, or the HPA, brain adrenal communication lines. It's really this brain, the CEO, miscommunication with its employees, the adrenal glands here. So your adaptation to stress is off, and adrenal fatigue is imbalance of the circadian cortisol rhythm. So cortisol is supposed to be higher in the morning, lower in the evening, this sort of nice S-shaped curve throughout the day. And cortisol is supposed to be lower in the evening to allow serotonin to be converted into melatonin and for you to have a good night's sleep. Adrenal fatigue, or HPA axis problems, are an imbalance of the circadian balance. So it could be cortisol high all the time, or low all the time, or high when it should be low, or low when it should be high. This roller coaster of cortisol imbalance. So cortisol gets a bad rap, right? I mean, because the people, the connotation is, oh, it makes me hold on to weight. It's just quote unquote stress hormone. So therefore it's bad. Just like anything else in the body, it's subject to the Goldilocks principle, and not too high, not too low, but just right. And in this case, just right at the right time. So it's not inherently bad. We need it for energy. We need it for regulation of blood sugar and blood pressure. We need it from an immune standpoint, and we need it from an inflammatory standpoint. It's anti-inflammatory. So we need cortisol. We just need the right amount of cortisol at the right time. Adrenal fatigue, this HPA axis issue, that's not happening. So common symptoms can be obviously fatigue, as the name would imply, but also being irritable, being hangry, that's hungry, and angry is evil stepchild, and craving salty foods to try to get the cortisol up that way, headaches in the morning that kind of wear off, that the very famous afternoon slump of energy, but getting a second wind of energy before bed, and you're like, what the heck, I've been tired all day, but now I can't go to sleep. Sleep issues is common with circadian rhythm issues, waking up in the middle of the night. These are common adrenal fatigue issues. So while 2 weeks at the beach is by all means good because it starts stimulating the parasympathetic resting and digesting system, these are very difficult cases, and they take time to heal. So, I mean, most people are rehabbing their brain adrenal axis over the course of a year, 2 years, to really get back what's been lost.
Holy moly, that is definitely more complicated than it sounds. And I had a suspicion it was, but did not know all the nitty-gritty details. And what I find most interesting is the craving for salty foods.
Yeah, so that's the body's sort of subconscious way to kind of create homeostasis, is through craving, getting that cortisol balanced with craving these salty foods. And again, you can have varying degrees of these symptoms. You can have one of them, but more often times than not, you have someone with HPA axis issue, adrenal fatigue symptoms, are having a myriad of those different symptoms.
Does craving sweets or starchy foods have any effect on this?
Yeah, it does. And I think that's another the balance of cortisol, which cortisol regulates blood sugar as well. And that's kind of the connection, the HPA axis and insulin resistant connection there. And you do see that. And people with reactive hypoglycemia, low blood sugar dips, people with insulin resistance, blood sugar problems, those often can go hand in hand with adrenal fatigue issues. So the hormones are all interconnected. So if you have one hormonal communication issue, you can have another. And it's a sort of vicious cycle of hormonal imbalances, which adrenal fatigue is one of them. And so is metabolic syndrome and reactive hypoglycemia and these blood sugar issues. And the connection there are many connections, but yeah, you can definitely crave the sugary foods and the starchy foods too. And that can be a part of this hormonal imbalance at large.
Sounds to me that there's a definite connection between adrenal fatigue and the development of type 2 diabetes.
Yeah, I mean, because if you have a mismanaged cortisol levels, that's definitely going to impact blood sugars. And conversely, if you look at from both the downstream and upstream chicken or the egg component, people with blood sugar issues, that's a state of inflammation. It's a state of stress on the body, and that can impact the neural output of the HPA axis. So again, it's connected in many different ways. It probably, what came first, the chicken or the egg, is down to the individual. And I've seen both. Insulin resistance contribute to adrenal fatigue, but also adrenal fatigue contribute to perpetuating inflammation and metabolic issues. So it can go both ways.
How can somebody know what the underlying issue is? Is there any sort of self-evaluation?
Well, yeah, we do actually have some quizzes on the website, on drwillcole.com. So if you go to the website and click the quizzes tab, we do have some great sub-diagnostic quizzes. It's not diagnosing anybody, but it's just saying more or less these are common symptoms that, okay, if you test positive for these quizzes, you may want to look deeper and find out from a lab standpoint. But yeah, there's a detailed questionnaire, sometimes obscure questions. We want to dig deeper in functional medicine to really see if this is a factor for you or not a factor for you. And you can have all of these symptoms that we're talking about and not have this issue. So there's many issues that can like mimic each other. So we don't want to be flippant and say just because you have these symptoms, that's for sure adrenal fatigue or a blood sugar issue. We have to ultimately, for someone, if it looks like a duck, we have to test and see if it is a duck. Because things can look like a duck in health and it not be a duck. There's a lot of duck mimickers out there.
So I talk to a lot of people that have issues sleeping. Some have trouble falling asleep, but what I find interesting are the ones that fall asleep fairly easily, but then they wake up for several hours sometime in the middle of the night. Do you think that's a relation?
Absolutely, yeah. So that is very common with HPA axis issues, adrenal fatigue symptoms, waking up in the middle of the night, oftentimes in a panic, their heart's racing, or they have to wake up to go to the bathroom and they can't go back to sleep. That is very common HPA axis issues, and can be a common metabolic issue with sleep apnea as well. But those are probably the two, I'd say circadian rhythm and metabolic sleep apnea issues are the most common ones that I see with sleep disturbances like this.
Now, on the surface, I would say that the most common cause of this would be chronic stress. Is that too simplistic?
Yeah, I think it's stress in all its forms. I think it can be mental, emotional stress. That definitely is a major component to that. The body is in this sympathetic sort of fight or flight. I'm being chased by a tiger, but there's no tiger mode. And that is a very common thing. People need to work on, and this is not an easy thing, and I don't want to make like it's like a light switch and everything's solved, but they need to really aggressively work on stimulating their resting, digesting, parasympathetic system in their body. That takes time. But yeah, they need to cultivate positive, calming activities in their life because our world is very much sympathetic. It's very fight or flight, always on the go, at least in the West. And people don't have any downtime because even their downtime is them staring at screens all day long, which activates the brain even more. So it's not set up to shut off and have some space and quiet. So that is important, is stress, but it's also physiological stress, not just the mental, emotional, life, external stress. It's also stress in the body. So things like gut issues, things like inflammation, and these other hormonal problems can perpetuate stress in the body as well.
So how would you treat something like that?
Well, I would first start from a lab standpoint to see if it's an issue for you or not. So we run either a full saliva panel, so it's about 5 vials of spit. It's a lot of spit. It's all day long to find out, but it's a lot of information about your hormones, looking at the circadian rhythm, the adrenal fatigue issues, looking at male and female hormones, looking at DHEA, which is another hormone that your adrenal glands secrete, and other aspects of your hormone pathways, or a urine test, which is another good way of collecting these hormonal information that we need. And then based on the circadian rhythm HPA axis issue would be the appropriate treatment protocol. So things like adaptogens can be one tool that we would use. It's not the entire tool, but it's an aspect of healing. Adaptogens like ashwagandha and rhodiola and holy basil and Tulsi, there's lots of good adaptogens, and what works for one person may not be right for the next person. So we really targeted as finding, in your life and based on your labs, how are these things impacting how you're feeling, and bringing mind-body aspects of it, calming aspects of it, as well as if there is DHEA, a DHEA deficiency, supplementing with appropriate amounts of DHEA and really targeted amounts, as well as cortisol precursors if low cortisol is a problem for you. And this sort of end stage aspect of adrenal fatigue, the problem is low cortisol, low DHEA, which again, people would think, well, isn't that a good thing? My cortisol is low. Again, you need it. You're going to feel completely miserable, like a truck hit you in the morning, and despite sleeping through the whole night, you're going to always feel irritable and tired if you have this sort of end stage low cortisol, low DHEA form of adrenal fatigue. And there's many different forms of it. But yeah, those people are going to need cortisol precursors possibly, as well as DHEA, to basically replenish what's been lost. But the goal is to bring function back and not just supplement with exogenous natural support, but actually get the body to do its job on its own. So that's stimulating the brain to be speaking properly with the adrenal glands.
Now, what I find really interesting, and this is probably on the tip of everybody's tongue who's listening to this, is you're in Pittsburgh. How can you do this? How can you treat anybody who doesn't come to see you in person?
Well, again, 75% of our patients are via Skype, and the internet makes a big world small. That's how people are listening to us right now. And honestly, our Skype patients get more care than our patients in the clinic physically, because we're talking to them in between visits and we're really a part of their life. And we have a team here devoted to giving them the support that they need. And it's way more support than they're getting from their average standard model of care doctor, where they're seeing them every 3 to 6 months and for 5 minutes. This is like quite involved. So it's really no limit, what we can do. I would say no considerable difference as far as us getting them the care that they need. So we would drop ship labs to them, and they would do the other labs at home or at a local lab facility if that's needed as far as blood is concerned. And the stool and the saliva, urine, those are typically done at home and drop shipped via FedEx or UPS to the appropriate labs. And then same with protocols. So we're either emailing protocols if it's just information that they need to be implementing in their life. We're talking via Skype if it's information they need to implement in their life, or if it's a physical, like herbal medicine protocol, then it's just drop shipped from the lab to their home. So it's pretty amazing getting people care wherever they're at in the world.
That is amazing. I do find that to be, and I'm wondering what kind of you must have some naysayers out there saying that there's no way you can treat me as well looking at me through a video camera as you could if you could see me in person and touch me?
Yeah, I mean, physical exams, that's obviously limited. So there's some aspects of it that is limited, but that's why we're really dealing with people that are, the labs tell a million words, the labs tell a million stories, and their health history, a comprehensive health history, tells a million stories. So to be honest with you, we're getting people better on an hourly, regular basis over the course that we're with them for about a year on average. It's not a quick fix, but we're seeing these success stories and these changed lives. And that's reflected. I mean, you can just read the people's story on drcole.com. They want to share their story after going through what they've gone through. Yeah, we don't see that being a problem, but their physical doctor that they've seen for years and hasn't seen a success, they kind of know at that point, wow, me being in the room for 15 minutes with them every 6 months is actually not that beneficial. What I'm looking for is results, not a physical, visitation.
Another ailment that I find really frustrating, and more so the people that have it than I, is fibromyalgia. What is that, and what can be done about it?
Good question. Fibromyalgia is one of those terms that's really just a description of the symptom, right? I mean, fibromyalgia, it's just fibrous muscle pain. That's all that name really implies. It really doesn't give a causation. It's just a description of how you feel. And it is multifaceted. So fibromyalgia really can be the etiology, the pathogenesis of the actual root cause of fibromyalgia can be different for different people. So some common things that someone with fibromyalgia should look for from a functional medicine perspective on this is looking at things like the gut and looking at the gut component to inflammation. The gut is, like Hippocrates said, all disease begins in the gut. So looking at leaky gut syndrome, which can contribute to systemic inflammation, which is gut lining permeability for those of you who do not know. Things are passing through the gut that shouldn't be passing through the gut, causing inflammation systemically throughout the body. Looking at things like autoimmunity. Fibromyalgia is not considered an autoimmune condition, but it has an autoimmune component at the very least, and it is associated with a lot of other autoimmune inflammation spectrum issues. So that's oftentimes where fibromyalgia is really just part of a larger problem of autoimmunity, which is, when the immune system is attacking parts of the body, causing this sort of wildfire inflammation. And anybody with fibromyalgia is going to tell you they feel inflamed. So that is a part for a lot of people with fibromyalgia, but not everybody. And then we have to look at toxins, so environmental toxins, heavy metal toxins, environmental toxins. That can contribute to inflammation in the body where it's not a full-blown autoimmune condition, but it is inflammation caused or contributed to by toxins. Looking at food sensitivities, which is really a gut issue, but also separately, they're eating food that's driving up systemic inflammation. Looking at viral issues like Epstein-Barr virus, which can drive up immune inflammation as well. And chronic fatigue, which can go hand in hand with fibromyalgia. So these are some of the things that we have to look at. And it could be all those things for some people, and it could be none of those for other people, and we have to dig a little bit deeper. So it's really about finding out what's driving that muscle pain, the fibromyalgia set of symptoms that we like to label with an ICD-10 code, but really what's causing it is more important than labeling it as how you're feeling, which is like, what the heck, I know I have muscle pain. Now, and some people want to be diagnosed because it gives them validation, but diagnosis really isn't the solution. And I find that the people that are diagnosed and the people that are undiagnosed, they're in the same boat. They're both left with no solution. So the problem isn't so much can we diagnose this or can't we, but what's the root cause of why we have the problem in the first place, which isn't a medication deficiency. So let's find what's actually driving the problem in the first place in my case, and not just this general labeling of diseases.
It's really horrible how many people I see with fibromyalgia, and it never seems to really be much better. They have treatments, they don't have treatments. Really, management and how the individual manages it is the only thing that matters. And what's really hard is when these people are overweight and they want to lose weight, and that's where I come in. But if they can't move their body, or if it's painful every time they move, just a simple movement, that really deters them from being physically active.
Absolutely, yeah. It's a debilitating problem, and one that's often a very common. They're given antidepressants and they're told, well, it's just depression. And these people know, heck, I'm depressed about my health problem, but my depression is situational. This is not the root cause of why I'm going through what I'm going through.
Yeah, taking an antidepressant isn't going to get rid of the pain that they're feeling when they move.
Yeah. It amazes me how many people are just labeled as depressed when, of course, they're depressed. Who wouldn't be depressed if they're going through these issues? But this is way more far reaching than this situational depression that they're going through because of their health issues.
Do you take insurance?
Functional medicine, certain parts of insurance is offset some aspects of functional medicine, like labs, for example. But by and large, insurance is not going to cover you getting healthy. And I had a patient tell me once, depending on my health insurance for my health is like depending on my life insurance for life.
He
said,
that's awesome.
And if I depended on my health insurance for health, I better have good life insurance. So the reality is your health insurance is amazing for crisis care. So I'm not saying, that there's no purpose for health insurance. There certainly is. We need it for crisis and emergencies and life-saving surgeries and situations like that. No one's going to take that away from what people need. But from a chronic care standpoint, I mean, anybody in this world that's going through a health problem knows this. I don't need to tell them this, other than the people that are just early on in their journey, they haven't learned this lesson yet, that your health insurance isn't going to pay for you to get healthy. They oftentimes don't even cover the medications they want to put you on. I hear the word donut hole on a weekly basis from elderly people that they're not covering these medications. So if they're not going to cover the medications, all these medications they want to put you on, they're certainly not going to pay for you to get healthy and get off the medications because the World Health Organization said it best, and WHO is anything but the, conspiracy theorist fringe group. The WHO said that there's an inherent conflict of interest, and I'm quoting them here, an inherent conflict of interest between the legitimate business goals and providers and what's rational for the patient, actually what's rational for us as consumers. So that is really what it's not set up. It's set up for disease management, which certainly has its place. And there's some people alive because of medications, but anybody in this system knows, look, this is not set up to get me healthy. This is set up to manage my disease, which again has its place. But we just ask the question in functional medicine, what is your most effective option that causes you the least amount of side effects? And if a medication fits that criteria, then Godspeed, that's awesome. And some people are alive because of medications. But it just so happens that medications oftentimes do not fit that criteria. They have lots of side effects. We all have seen the drug commercials before. We know that. And they aren't very effective, which is why instinctively everybody knows, hey, I'm going to have to be on this for the rest of my life. Well, you have to be on it for the rest of your life if you keep doing the same thing and expect a different result. You have to do something different to see different results. And the system's not set up for that. It's set up for see you in 5 minutes and here's this medication, see you in 6 months. And that's this sort of diagnose a disease, match it with a corresponding drug. That's what they'll pay for, and if that. But it's functional medicine is coming from it from a bigger standpoint.
That is such a sad state of our very advanced society.
Yeah, I mean, I'm sure you have listeners in other countries. I think that we have the best country in the world, and if you look at the statistics here, we have emergency care. This is like the World Health Organization's statistics, the American Medical Association, the actual AMA statistics. The United States is one of the best countries as far as emergency care. Like if someone needs a surgery, they're going to come here, and we have some of the best. But as far as chronic care, we are dead last or second to dead last as far as chronic health care. So this is something that, not just my opinion, it's the World Health Organization's opinion and the AMA's opinion as far as how we handle chronic health problems.
We need people like you.
Yeah, I mean, the problem is there's so many people to help that we need more people in functional medicine. And what's cool about places like the Institute for Functional Medicine, IFM, is that they are educating these mainstream doctors in the hospitals, in the private practices about functional medicine. And what's sad is that, most of my colleagues are in the mainstream model of care still, but learning these things that they haven't learned in medical school, which is really just diagnose and prescribe. Once they've learned about it, a lot of them have to leave the mainstream model of care, leaving the hospitals to actually get somebody well, because this is not me indicting or functional medicine indicting any singular doctor. This is about a systemic issue that is the problem here, where even if the doctor wanted to do more for you, even if they've learned about functional medicine, the system says you have 5 minutes with them and they don't even have the time to give them what they want. Or if they tell them something beyond that, they get flack from the upper in the hospitals, like the upper levels of it, because it's like, look, this is not what you're supposed to be doing. So it's a systemic issue.
Thank you, Dr. Cole. You've really given us a lot to chew on, to think about, and I really hope anybody out there with these chronic issues that we've discussed and many more that we haven't, give you a look, or at least another functional medicine person. I really am all in favor of allowing the body to heal itself, and there's far too many chronic issues. So I know you dropped it a couple times, but for anybody who didn't catch it, how can people get a hold of you?
You can go to drwillcole.com. That's drwillcole.com. And we offer free webcam health evaluations for people around the world, just to see if functional medicine is even right for you and get a functional medicine perspective on what you're going through.
That's fantastic. I will, of course, have that link and a few others on the show notes page at livefitpodcast.com. Dr. Cole, thank you very much. It's been enlightening, and I wish you the best of luck with all the droves of people that are going to come see you.
Well, thank you so much for having me.
Thanks for listening. If you enjoyed this episode, please do me and others a solid by rating it, reviewing it, subscribing, and most importantly, sharing with somebody you care about, because it just may help save their life, at least make it better. Talk to you next time.
Thank you for listening to this episode of the Live Fit Podcast. Please subscribe and share with someone you care about. Read show notes, articles, resources, and learn more about our weight management programs at livefitpodcast.com. Once again, thanks for listening, and always remember to live fit.